Hey everyone, it's Raj from 3CB Performance. Dallas Mavericks phenom and early season MVP candidate Luka Doncic suffered a quote moderate right ankle inversion sprain in the opening minutes of the Mavs game versus the Miami Heat on December 14th. In this video, I'll explain the injury, diagnostic process, when Luka may be back, and one major risk moving forward. Luka's ankle rolling inwards, aka inversion, stressed the lateral outer ligaments of the towel curl TC joint. The ligament most commonly involved in damage is the anterior talofibular ligament, ATFL. This inversion movement also comes with the risk of fracturing the lateral malleolus, the knob on the outside of the ankle, and endpoint of the fibula, which is why Luka had x-rays immediately following the game rule that possibility in or out. His x-rays were negative. Multiple accounts have reported the injury as a quote moderate sprain, which commonly translates to a grade 2 ligament tear, aka incomplete tear. Diagnosing ankle sprain severity and grade is based on a series of clinical indicators. For a moderate grade 2 sprain like Luka's, this would include difficulty weight bearing, a manual examination with findings of moderate tenderness, decreased ankle range of motion, increased laxity, looseness of the towel curl ankle joint during an anterior drawer test, and/or manual inversion, and moderate 1 to 2 centimeters of swelling with possible bruising. Further, Luka very likely underwent an MRI. However, unlike many other soft tissue injuries, MRI isn't as accurate for ankle sprains. For example, with ACL or meniscus tears, an MRI has roughly 95% accuracy, yet that accuracy falls to below 75% with grade 2 ankle sprains. Additionally, Luka likely underwent a stress radiograph, which is an x-ray taken while performing the anterior drawer test I mentioned earlier and the Taylor tilt test. Typically, the radiologist is looking for significant side-to-side differences in joint gapping, which indicates ligament tearing. The average RTP timeline after a grade 2 inversion sprain is 2 to 3 weeks, with Luka's return dependent on how his ankle responds to therapy. Key aims of treatment will be limiting ankle stiffness and maintaining range of motion, particularly dorsiflexion, which is commonly affected after an ankle sprain. Restoring strength in the foot and ankle complex. Improving postural control and proprioception, which has proven to be one of the most effective ways of preventing future ankle sprains, and maintaining fitness through modified activity. For example, Luka was said to already be running on an underwater treadmill, which allows you to de-weight the lower body at halftime following the injury. Doncic will constantly be evaluated and re-evaluated for pain and discomfort in the ankle, and undergo a battery of side-to-side tests that commonly include the lateral hop test and star excursion balance test, SEBT. The greatest challenge of managing an ankle sprain in athletes is preventing recurrence. The two strongest predictors of re-injury are a previous ankle sprain and premature return to play. Accordingly, the research shows that basketball players are 5 times more likely to re-sprain the ankle, with some studies showing a recurrent rate of upwards of 73%. Further, upwards of 70% of players with recurrent ankle sprains develop either persistent symptoms or a condition known as chronic ankle instability, CAI, which is characterized by constant stiffness, weakness, and feelings of instability and low confidence in the ankle, aka kinesiophobia, fear of movement. For these reasons, it makes sense for the Mavericks to be as prudent and methodical as possible with Luka's return. Obviously, we know he wants to be out there on a team that has relatively high aspirations and are currently facing a really tough 3-week stretch, but short-term goals need to be balanced with the longer-term view of increased re-injury risk and potentially developing long-term symptoms for the 20-year-old superstar who figures to be the face of the Mavericks franchise for years to come. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis, and you can always find me on IG and Twitter at 3CB Performance. Make sure to sub to the channel for the latest updates. 3CB out.